Hi, I'm Len Jason, and I'm a professor of psychology in the psychology department. And Olya Glantsman has asked me to give a presentation to her Psych 618 Community Psychology graduate level class. It's October 31st, 2024. And I thought I'd start out by giving a little bit of the history of the program, how it started up. For those of you who are interested, Ed Solik was the person who came to DePaul in the mid 1960s, right around kind of when Swampscott, the beginning of the field of community psychology, was occurring. And they asked him to develop a doctoral program. So he began developing it at a clinical community doctoral program. And about 1967, 68, his first classes were recruited. And the first graduates came out early 1970s, 1973, 74, 75. So DePaul University actually has one of the oldest clinical community psychology programs in the country. So we can be very proud of that work of Ed Solik and his other faculty. In 1975, the clinical program was not accredited, so they basically brought in three clinical psychologists, myself, Jack Reisman, and Sheila Raborti. So with that three, we had then a director of clinical training, Jack Reisman, and we had enough clinical faculty to begin preparing for accreditation in the American Psychological Association, which occurred in 1980. Ed Zolik was kind of an interesting person in terms of how he negotiated things. And for example, current family and community services, which we'll call the Community Mental Health Center, he was able to obtain by writing a grant proposal. And that particular services program is now entering its 50th year. But how did Ed Zolik kind of get these types of things? The priest house, which was next to the psychology department, had a number of priests that he would kind of visit. He actually lived with his wife right across the street on Kenmore and would actually kind of bring a bottle and they would sit around and kind of talk into the evening. So we had a very good relationship with the executive officers, including the president, and it was able to get approval for all types of initiatives, including the Community Mental Health Center. That was just beginning when Jack and Sheila and myself kind of arrived. Just a little bit about the clinical program. When I got there, I was kind of surprised that there were very few females, and people of color were just not in the program. Our first Latinx students came in 1977, and it wasn't until the early 1980s that Vicki Sloan came in, African American student. She had been president of Psych, and I worked with her closely as we kind of tried to begin to get the program to be more diverse. And very, very happy to see clinical program and the community program and the other programs have such diversity. But it wasn't an easy task. And again, sometimes one has to kind of be in a setting and get the trust and respect of your colleagues to begin to kind of make changes. Jack Reisman, who was the clinical training director, I spoke to many times about the fact that we were delivering services to kind of Cabrini Green, which was at that time primarily African American, low income. And I asked why we weren't trying to bring in more graduate students and faculty that had diversity. At one point in the early 80s, he sort of looked at me and said, if you can do it better, why don't you take the job? And I said, okay. So I was director of clinical training for a period of time where I made one of my focuses to try to bring in more people that had more diversity. Well, getting back to the Midwestern Psychological Association, because Um, that actually is something that DePaul had some involvement in developing community psych, SCRA, Society Community Research and Action Programming. Ed Zolik was able to talk to the executive team at the MPA as he did with the priests at DePaul and kind of bring his model into the parties at MPA. And he pledged to them some type of support for someone who would be the volunteer director of volunteers. He said, well, I'll make sure DePaul takes care of volunteers and I continue to bring in different types of beverages, but can you give me a couple rooms? And the first MPA interest groups on community site began in 1976. And I might add that Ed Zolik asked me to coordinate volunteers for the Midwestern Psychological Association. So I did that for several years. So MPA got something and we got something. And we just had discussion groups, 1976, 77. And then we started really begin to meeting some of the other people in Chicago. Chris Keys, for example, at University of Illinois, Chicago. I met him at one of those interest groups, 1977. And by 78, Howard Markman gave a presentation. We all said, well, why don't we do this more than once? It's once a year in the spring. So the idea came of having kind of a fall program called the Eco Community Psychology. And the Midwestern Eco Community Psychology first meeting occurred in 1978 at Michigan State University. And I drove up there with a couple of graduate students, and other people drove up with their graduate students. And Ann Bogat was one of the people that drove up with me. And she ended up taking a job at Michigan State when she graduated. But there was no program, there was no registration fees. We got there and we just sort of talked about, we would have discussions each hour, different topics. And George Fairweather gave an address to us. It's the only thing that was planned. And then he had a barbecue at his house in the evening. We slept on the floors of people and we really got to know folks. This informal capacity occurred with the next ECO conference at Indiana University. And by 1980, at Bowling Green University, we began thinking about the next conference. And at the end, several faculty were sitting around talking, and graduate students were in the room. And as we began thinking about what school might take it for the next year, 1981, one of the graduate students said, well, why are you folks making those decisions? Why aren't the graduate students making those decisions? Because it is a graduate student conference. So we said, great idea. So from 1980 to the present date, 2024, the graduate students have run ECO. So it's really an amazing social setting. For 48 years, this particular folks in the Midwest have had these meetings. They've been very successful ways of people meeting others and connecting. And the Midwestern Eco Conference is so successful that the eastern part of the U.S. began developing those in the Southeast and the West as well. So it became a kind of an informal gathering, and eventually they developed every 2 years kind of a biennial so to bring everyone together. But the first effort to bring folks together was really at both MPA with the SCRA programming, as well as the program for ECO that started in 1978. And people really had a chance to meet others and get really all types of opportunities. I still remember Steve Fawcett from the University of Kansas bringing a whole band of students, including Fabricio Picasso and Yolanda Suarez. And at that conference, again at Bowling Green, Chris Keys had a chance to sit in on their topic and hear about what they were doing, and that began a friendship that ultimately resulted in Fabricio and Yolanda coming to Chicago, where they've been for most of their career. So those types of connections really help with training opportunities, jobs, and all types of networking does occur at these conferences. And just a little bit about DePaul University, getting back to, as we said, this particular clinical training program is one of the earliest clinical community ones in the country. And we developed a undergraduate concentration in community psych in 2006. So that was something Olya Glantsman, who was finishing up the doctoral program, has been running since then. And then in 2000, which was a couple years before that, we developed Deacon Joe Ferrari and myself a PhD in community psych, and in 2020 a combined master's program. So that was something that students could get a 5-year degree in master's or just a terminal master's in community psych. And Olya Glantsman has been also directing that program since it started, and Jerry Cleveland was very helpful in kind of helping set that program up as well. So again, in this period of time from the 1960s to today, 2024, DePaul University has really probably more training in community psych than just about any other place in the country, with a undergraduate concentration in community psych, with a combined master's program in community psych, with a doctoral in community psych, and a doctorate in clinical community psych. So we're very proud of the traditions that have occurred over the years. And I hope this short history gives you a little bit of an idea of kind of why DePaul University has been such an influential setting for so many years. Thank you.